Here we are. Yes, so it is something about healthcare and emergency situations, right? So, healthcare and emergency situations in Japan. Again, I will say, God forbid, if it is required, like we have to, go through all this. Because yes, of course, when we are in need of any kind of medical emergency, we have to, be there. So let's see what are the important aspects and like how we should deal with this kind of situation. Yeah. So facts about healthcare. So as it's mentioned that Japan has a universal healthcare system. All residents are required to have health insurance, which ensures access to affordable medical care across the country. Yeah, it's a truth. It's a fact that in Japan, all of us, all the natives of Japan are supposed to take healthcare insurance. It is not optional or by your choice. It is mandatory, and the insurance is being taken. And all those who grow old or maybe who fall sick, that they are always those kinds of patients who are in need of, healthcare emergencies or assistance are prioritized by the government of Japan also. Japan is known for its advanced medical technology, low infant mortality rates, and one of the highest life expectancies in the world. Yeah, that's true because they have the most advanced medical technology. Their machineries and everything are very, very much mechanized and comprising of high technology. Now, common symptoms and vocabulary, like if you have a symptom or any one of you has a symptom and you need to, convey it to any medical practitioner or doctor for assistance and for medical help. So these are the terminologies usually. Yeah, I'll start from the left side of the slide. The first is headache. So headache is said to be jutsu, jutsu. Then nosebleed is hanaji, hanaji. Cough is seki, seki. Fever is netsu, netsu. Sneezing is kushami, kushami. Catching cold is kaze, kaze. Influenza is influenza, influenza. Asthma is zensoku, zensoku. Stomachache is fukutsu, fukutsu. To vomit, hakike, hakike. Chickenpox is suito, suito. Rash is hoshin, hoshin. Heart attack is shinshi, haisaku, shinshi, haisaku. Diabetes is toyobyo, toyobyo. Allergies, allergy, allergy. Hay fever is kapuncho, kapuncho. Diarrhea is keri, keri. Mumps are kaze, kaze again. Virus is virus, virus. Gut pain is shishin suru, shishin suru. Now let's see to the right side again. About health in Japanese, sickness is byoki, headache is jutsu, toothache is shitsu, stomachache is itsu, office seki, runny nose is hanamizu, fever is netsu, influenza is influenza, right? Disease is memai, injection is jusha, medicine is kusuri, and common cold is kaze. I would like to repeat the these symptoms vocabulary. Let's begin again. Headache is jutsu, jutsu. Nosebleed is hanachi, hanaji. Cough is seki, seki. Fever is netsu, netsu. Sneezing is tushami, tushami. Catch a cold is kaze, kaze. Influenza is influenza, influenza. Asthma is zensoku, zensoku. Stomach ache is ukutsu, ukutsu. The vomit is hakike, hakike. Chickenpox is suito, suito. Rash is hoshin, hoshin. Heart attack is shinsei, hatsoku, shinsei, hatsoku. Diabetes is toyo, byo, toyo, byo. Allergy is allergy, allergy. Hay fever is kapuncho, kapuncho. Diarrhea is gary, gary. Mumps are kaze, kaze. Virus is virus, virus. Faint is shishinsuru, shishinsuru. Again, to the right side of the slide, we have sickness, byoki, byoki. Headache is jutsu, jutsu. Toothache is shitsu, shitsu. Stomach ache is itsu, itsu. Cough is shaky, shaky. Running nose is hanamizu, hanamizu. Fever is netsu, netsu. Influenza is influenza, influenza. My is easy, easy. Injection is chusha, chusha. Medicine is kusuri, kusuri. Common cold is kaze, kaze. Yeah, here we have understood some common terminologies in terms of sickness and symptoms. Then some sample sentences for describing illness. So if you need to describe your illness, these are some of the sample sentences. Like, for I don't feel well, it is guaiga varuides, guaiga varuides. Next is this covered by my insurance? Oreva watashi no hoken ni haitte imasu ka? Oreva watashi no hoken ni haitte imasu ka? Hoken means insurance, right? I have a headache. Atama ga itai desu. Atama ga itai desu. I have a stomach ache. Onaka ga itai desu. Onaka ga itai desu. I have the flu. Influenza ni kakatte imasu. Influenza ni kakatte imasu. I have a broken bone. Hone o orimashita. Hone o orimashita. I have been experiencing these symptoms for a week. Right? So, hojo wa ishukan suzuite imasu. Hojo wa ishukan suzuite imasu. I have an allergy to penicillin. Watashi wa penicillin allergy ga arimasu. There is a bathroom. Toire wa doko desu ka? Toire wa doko desu ka? How many times per day do I take this medicine? This is a very important phrase. Ichinichi nankai nomimasu ka? Ichinichi nankai nomimasu ka? Okay. So I will speak the Japanese sentences, these phrases again. Guai ga warui desu. Guai ga warui desu. Kore wa watashi no hoken ni haitte imasu ka? Kore wa watashi no hoken ni haitte imasu ka? Atama ga itai desu. Atama ga itai desu. Onaka ga itai desu. Onaka ga itai desu. Influenza ni kakatte imasu. Influenza ni kakatte imasu. Hone o orimashita. Hone o orimashita. Shoujo wa ishukan suzuite imasu. Shoujo wa ishukan suzuite imasu. Watashi wa penicillin ni allergy ga arimasu. Watashi wa penicillin ni allergy ga arimasu. Toire wa doko desu ka? Toire wa doko desu ka? Ichinichi nankai nomimasu ka? Ichinichi nankai nomimasu ka? Okay. Other useful Japanese phrases to know. So, medical aid is ireo enjo. Ireo enjo. I need an ambulance. 救下个必要です。救下が必要です。I had an accident. 事故に遭いました。事故に遭いました。Medical emergency. 医療緊急事態。医療緊急事態。Please お願いします。お願いします。Heart attack 心臓発戦。心臓発戦。I need a doctor. 医者が必要です。医者が必要です。Fire brigade is 消防隊。消防隊。having birth 出産中 or 産人になりました。産人になりました。I will repeat all these phrases again for your reference. Medical aid is 医療援助。医療援助。I need an ambulance. 救急車が必要です。救急車が必要です。I had an accident. 事故に遭いました。事故に遭いました。Medical emergencies. 医療緊急事態。医療緊急事態。He says お願いします。お願いします。Heart attack is 心臓発戦。心臓発戦。I need a doctor. 医者が必要です。医者が必要です。Fire brigade is 消防隊。消防隊。Giving birth is 出産中。産人になりました。産人になりました。So these are also very important phrases we need to know. Okay. Now making appointment phrases, like when you have to make an appointment with a doctor at the hospital, and these are the common phrases which are used. I would like to make an appointment. Yo yaku o shitai desu. Yo yaku o shitai desu. Is there an appointment available this week? 今週空いている予約はありますか？今週空いている予約がありますか？ I need to see a doctor as soon as possible. I need to see a doctor ASAP. できるだけ早く医者に会いたいです。できるだけ早く医者に会いたいです。I have an appointment today. 今日予約を入れました。今日予約を入れました。How are you feeling today? 今日の気分はどうですか？今日の気分はどうですか？ Not very well. あまりよくありません。あまりよくありません。I think I sprained my left ankle. 左足首を捻挫したと思います。左足首を捻挫したと思います。And in the same way, if you want to say, I think I sprained my right ankle, so you will replace the word hidari with migi. 右足首を捻挫したと思います。右足首を捻挫したと思います。I feel a sharp pain in my right knee. 右膝に鋭い痛みを感じます。右膝に鋭い痛みを感じます。Okay. Clinical phrases. So what are the clinical phrases? Doctor is Isha. Kangoshi is nurse. Kusuri is medicine. Hokensho is insurance card. Taiyon K is thermometer. Band-aid is Ban Soko. Prescription is Shoho Sen. Patient registration card is Shin Satu Ken. Shin Satu Ken. I repeat the words again. Doctor is Isha. Nurse is Kangoshi. Medicine is Kusuri. Insurance card is Hokensho. Thermometer is Taiyon Ke. Band-aid is Bansoko. Prescription is Shoho Sen. Patient registration card is Shinsatsuken. Shinsatsuken. Hi. Now, Japanese prescription abbreviation. So these are usually the journal abbreviations which are mentioned on the prescriptions prescribed by the doctors. Ichijo o ichinichi sankai. Ichijo o ichinichi sankai. One tablet 3 times a day. Shokuzen ni before meals. Shokuzen ni is before meals. Shokubo ni after meals. Shokubo ni after meals. Asa to yoru in the morning and in the evening. Asa to yoru in the morning and in the evening. Eikyo bubun ni nuru. Eikyo bubun ni nuru apply to the affected area. I'll repeat these abbreviations again. Ichijo o ichinichi sankai. One tablet 3 times a day. Shokuzen ni before meals. Shokugo ni after meals. Asa to yoru in the morning and in the evening. Eikyo bubun ni nuru apply to the affected area. Then pharmacy interactions, when you go to any pharmacy outlet and what are the interactions being done there. Some of the phrases are given here. Requesting medication. Kono kusuri o kudasai. Kono kusuri o kudasai. Over the counter medication. Shoho sen nashi de kairin kusuri. Shoho sen nashi de kairin kusuri. Next is prescription medication. Shoho sen ga hitsyo na kusuri. I repeat, Shoho sen ga hitsyo na kusuri. And asking for a generic alternative. When you are asking, like, for example, the medicine at the pharmacy shop is not available, which you are looking for. And obviously, the pharmacist will give you some alternative, an alternative medicine. So, generic, in case you talk about the generic medicine. So, asking for the generic alternative. Doseyaku wa arimasu. When, like, I'm at the pharmacist and I'm asking, is there any other alternative generic medicine for this? So, doseyaku wa arimasu. Then it's explaining generics. Onaji kouka de yasui kusuri desu. Onaji kouka de yasui kusuri desu. So I'll be repeating all these Japanese phrases again for you. When you request a medication and you want to say that I would like this medicine, please. Kono kusuri o kudasai. Kono kusuri o kudasai. Next is over-the-counter medication. Means you want to say that medication that doesn't require a prescription. Like, right? So shoho sen nashi de kairu kusuri. Shoho sen nashi de kairu kusuri. Next is prescription medication. Medication that requires a doctor's prescription. Shoho sen ga hitsyo na kusuri. Shoho sen ga hitsyo na kusuri. Do you have a generic version? Dose yaku wa arimasu ka? Dose yaku wa arimasu ka? And it's the equivalent medicine but cheaper. Onaji kouka de yasui kusuri desu. Onaji kouka de yasui kusuri desu. I think from all these phrases are clear. Now let's move further to the emergency services in Japan. So for police, we have 110. For police, we have 110. For ambulance, we have 119 to dial. These are the, like in every country, there are emergency numbers. For fire department, it is 119 again. Okay. And then for child abuse, if you want to complete a complaint, that is 189, 189. For non-emergency medical, like there is no much emergency, but still you need medical assistance, 7119. And Coast Guard is 118. So in Japanese, how do we say these numbers? Like for police, we say 110, ichi, ichi, 0. For ambulance, it is 119, ichi, ichi, q. For fire department, it is 119 again, ichi, ichi, q. For child abuse, it is 189, ichi, hachi, q. For non-emergency medical, it is 7119. It is nana, ichi, ichi, q. Coast Guard is 118. It is ichi, ichi, hachi. So I'll be repeating the numbers in Japanese again in the same sequence as I said earlier. Ichi, ichi, zero. Ichi, ichi, Q. Ichi, ichi, Q. Ichi, hachi, Q. Nana, ichi, ichi, Q. Ichi, ichi, hachi. Okay. So these are the key phrases at the time of emergency. God forbid you have any medical emergency. And what kinds of phrases we must know. And these phrases are usually used when you call an ambulance. Q sha o yonde kudasai. Please call the ambulance. Q sha means ambulance. Q sha o yonde kudasai. Next is he or she is not breathing. Kare or kanojo wa kokyu shiteimasen. Kanojo wa kokyu shiteimasen. It's an emergency. Hinkyu yitai desu. Hinkyu yitai desu. Where is the nearest hospital? Ichiban shikai byoin wa doko desu ka? Ichiban shikai byoin wa doko desu ka? I don't feel well. Kibun ga warui desu. Kibun ga warui desu. I have an accident. Chiko ni aimashita. Chiko ni aimashita. There's been a fire. Kaji ga arimashita. Kaji ga arimashita. Help me, please. Tasukete kudasai. Tasukete kudasai. So for your understanding and correct understanding of phonetics and pronunciation of phrases, I am repeating the phrases again. Kyūkyū sha o yonde kudasai. Kyūkyū sha o yonde kudasai. Kanajo wa kokyū shiteimasen. Kanajo wa kokyū shiteimasen. Kinkyu yitai desu. Kinkyu yitai desu. Ichiban chikai byōin wa doko desu ka? Ichiban chikai byōin wa doko desu ka? Kibun ga warui desu. Kibun ga warui desu. Chiko ni aimashita. Chiko ni aimashita. Kagi ga arimashita. Kagi ga arimashita. Tasukete kudasai. Tasukete kudasai. Okay. Do's and don'ts in Japanese emergency situations. What are the do's and don'ts which we should not do? Call for help immediately. This is the greatest do. Yes, of course, for each one of us, not only in Japan, everywhere. Stay calm and speak clearly. No panic and stay calm and speak clearly. Carry identification or health insurance card. We need to have our IDs with us when we are visiting the hospital or for any medical emergency. Learn a few emergency phrases in Japanese. Yeah, this is the most important. I have discussed so many phrases and terminologies for medical emergencies. Even the symptoms also, we must know few of them. And what are the don'ts? Don't panic or shout unnecessarily. Correct. Usually we find when we are in panic, we just shout and we are so much in pain, but that time we have to keep calm. Do not ignore official instructions, whatever at the medical centers, whatever instructions are given to you, please follow them, obey them. Don't use your phone during evacuation unless necessary. In Japan, this is a very important thing because usually at the time of earthquakes or these kinds of natural calamities, it happens that there is there are chances of short circuit or fire also. So better not to use your phone. This is the basic instruction which is given even to the young kids when they are training that do not use the lift at the time of after this earthquake and do not use your cell phone. Right? Don't block emergency exits or routes. We should not block those entries. This is also a very important emergency time, do's and don'ts. Okay, so I hope we had understood all the phrases, and it's very important for us to follow these instructions and learn all these